The information provided on this video is for educational resources only. It is not intended to serve as a recommendation for the treatment or management of any medical condition. As with any new exercise program, it is advised to consult with your healthcare provider prior to performing these activities. These exercises should be performed with no pain. If you experience any pain or discomfort, stop immediately and seek attention from your healthcare provider. This video is an introduction to stretches and exercises to target the muscles that may become tighter or overworked due to postural and hormonal changes that occur during pregnancy. The first set of exercises can be done at home in a chair, or if you're working, can be done at your desk. You have a muscle on the inside of your thigh called the adductor group of muscles. Gently bring your leg out to the side, sitting at the front of your chair. You should feel it down the inner thigh. You can lean forward a little bit if you need to. The leg is in a diagonal position. Hold for 30 seconds. Repeat each side, making sure to breathe as you're doing this stretch. Again, this should not be painful. If you follow the yellow, red, green stoplight method, red is pain, you should stop. Green, no pain, you can continue into the stretch. Yellow is a little bit of tightness, tenderness, don't push past that. The next is the hamstring stretch. It's a muscle at the back of your leg, from your buttocks into your knee. Bring the leg forward into the chair. Again, you can lean forward if you need to feel a deeper stretch. Hold for 30 seconds. Repeat each side. All of these stretches can be done multiple times a day as needed. The next muscle is called the piriformis muscle. It's located in the buttocks and lateral hip. You'll cross one leg over into a figure 4 position. This may be difficult for you to achieve, but if you can, it's a nice stretch into your buttocks. You can lean forward towards that knee that's up, stretching both sides. The last of the leg stretches is the front of your hip or the hip flexor group. For this one, you'll need to shift your body over to the side of the chair. You'll bring one leg back, the knee pointed towards the ground. You should feel the stretch at the front of your hip. If you need more of a stretch, you can tuck your buttocks in, feeling that stretch. Holding for 30 seconds each side. Now we'll address the muscles in your upper spine and shoulders and neck. The first one will work on the middle of your spine or mid-thoracic region. You'll interlace your fingers, push them forward, round the back, drop the head. Feel that nice stretch through your shoulder blades. You can come in and out of this, hold for 10 seconds, stretch again, allowing for just a nice movement. This is especially helpful for women that work at a desk, maybe are on their computer all day. Just a nice way to get that stretch. This next stretch is meant to help with your range of motion of your neck. Gently drop your head down towards your chest, tucking your chin in, feeling that stretch through the back of your neck. Roll to one side, allowing that ear to move to your right shoulder. Feel that stretch on the side of your left neck. Now roll down, back to your chest, and roll to the other side. You notice that we're not looking backwards, really trying just to target from shoulder to shoulder and down into your chest. Lastly, when we're working with your shoulders to help that range of motion and that tightness, you can do shoulder circles. Basically, bring the shoulders up to your ears, roll them forward, continue in the circle as you squeeze your shoulder blades and roll them backwards. You can do 10 of these, continue to rolling forward, 10, and then change the direction and roll backwards. So roll towards your shoulder blades and then forwards towards your chest. If you're finding that you're a little stiff when you've been standing or you have a moment to take a break from your day, you can do a few exercises in the standing position. First, we'll look at pelvic tilts. So as the belly's pulling you forward, you can work on the range of motion through your spine and your pelvis, gently tilting your pelvis backwards as you tuck in your buttocks, and then returning back to neutral position. Squeezing the buttocks, engaging the belly as you tilt your pelvis backwards. Next, we'll look at the front of your hip again, the hip flexor stretch. One leg will be back, almost into a mini lunge, the other leg forward, slight bend in the knees. You're going to tuck your buttocks in, feeling the stretch in the front of your hip and into the lower abdomen. If you need more of a stretch, you can raise your hands up in the air and lean away from the leg that's pointed backwards. Gentle stretch, hold for 30 seconds. Repeat on the other side. The next set of stretches and exercises will be performed on the floor. If you have trouble getting on and off the floor, this may not be the set of exercises to perform for you. So the first stretch is called cat camel, allowing for stretching through your entire spine. You'll place your knees hip width apart. You'll bring your hands down underneath of your shoulders. You'll start with an arch in your back as you drop your head, feeling that nice stretch through the middle of your back, your neck, and into your low back. And then come up and bend your spine, looking up towards the ceiling. And repeat this 10 times gently, just feeling that stretch and breathing throughout. If you have pain in your wrists, you can alternate this by putting your hands into a fist, allowing for no bend in your wrist and arm. The next exercise is child's pose. This allows, again, stretching through the low back and into the buttocks. With your toes together, your knees open to allow room for the belly, you'll bring your hands towards the floor, setting your buttocks into your heels, feeling that stretch as you breathe. You can also lower your elbows to the ground, making sure to keep that buttocks back, breathing and stretching. You can shift from one side to the other, so bringing your arms out to one side, feeling that stretch. Again, do this as tolerated. Lastly, we want to make sure that we have strong muscles in our hips to ensure stability of the pelvis. I'll have you lie on your side. This is called the clamshell. So on your side, you'll place your head on a pillow, making sure your spine is in neutral, that you're not rolling forwards or you're not rolling backwards. The hip should be pointing straight towards the ceiling. With your feet together, you're going to open your knee, and that's why it's called a clamshell. It looks like a clam is opening. So preventing the hips from rolling backwards or forwards. Performing 10 of these. You should feel the contraction or the activation in the back of your hip, not down the side of your leg. If so, look at the rotation of your pelvis. Once you perform the exercise on one side of your leg, make sure you roll over to the other side and perform 10 on that side as well. So a yoga ball is a nice tool that women during pregnancy find helpful to alleviate pain in their back and their pelvis. If you have one at home, you can incorporate it into your exercises. Otherwise, one can be purchased at a department store or online. So with this stretch, you'll place your hands on the ball, spread your knees to allow for room for your belly, and then push the ball away from you as you gently feel that stretch into your low back and buttocks. No need to push into this, just a gentle stretch. You can work in and out of it depending on how you're feeling. You can do a long stretch of 20 to 30 seconds, making sure to breathe the entire time. You can alter the direction of the stretch, moving the ball one way, feeling the stretch on the side of your back, and then the other way, feeling the other side of the back stretch. You can also use a yoga ball to sit on during your day if you're feeling a little discomfort or need to change positions. It can help allow for a pelvic neutral position, and alleviate any pressure you might be feeling in your pelvis. An exercise that you can perform while on the ball is tilting your pelvis, gently engaging your abdominal muscles, called the transverse abdominis, drawing that belly button towards your spine as you rock the pelvis backwards, stretching into the low back, and returning back to neutral. There shouldn't be a lot of movement in your shoulders or your upper back. This is really an isolated pelvic exercise. You can also perform pelvic circles. You start by tilting your pelvis forward, rocking it to the side, backwards, and then to the other side, making small circles, shifting the weight from front, side, back, side. You can perform 10 of these and then alternate the direction of the circle, reversing from side, back, front to other side.